Hello, everyone. I'm Dr. Monica Malampalli, your host for this episode of Women Talk. September is National Pain Awareness Month, and as we enter the third year of living with COVID 19, the most recent Census Bureau's Household Pulse Survey found that 16.3 million people, which is around 8% of Americans, currently have long COVID. This is an alarming statistic we are still learning about. That is why, in partnership with Practical Pain Management, Healthy Women is hosting a two-part Women Talk series focusing on chronic pain and long COVID symptoms. On today's episode of Women Talk, we're going to be speaking with Dr. Dawn Goldenberg, an expert on fibromyalgia and rheumatic disorders. Dr. Goldenberg is Emeritus Professor of Medicine at the Tufts University School of Medicine and an adjunct faculty in the Departments of Medicine and Nursing at Oregon Health Sciences University. He has also recently published several reports on long COVID for Practical Pain Management, where he's on their editorial advisory board. We will also be hearing from Leslie Stolken, a patient advocate who has been struggling with long COVID, and we'll hear more about her symptoms shortly, actually, directly from her. So let's begin. I want to welcome you both to our today's show. So Dr. Goldenberg, let's start with you. What is long COVID, and what do we know about this ever-evolving condition?
Well, long COVID is basically defined as persistent symptoms after COVID-19 infection that last for usually months. Most people would say at least 1 to 3 months after the infection. The symptoms are variable. They usually include exhaustion, very chronic fatigue, chronic pain, shortness of breath, often, as Leslie will tell you, loss of taste and smell, headaches, a multitude of symptoms. I like to think about two subsets of the condition. One where patients usually they were hospitalized, had well-defined organ dysfunction during the hospitalization, like pneumonia or inflammation in the lung, and continue to have problems with shortness of breath, et cetera. Something that we would be consistent with other post-infectious diseases. The majority of patients actually with long COVID may not have had organ damage during the hospitalization. In fact, they may not even have been hospitalized. Some even are asymptomatic initially with their infection. And that's what's so perplexing. Patients continue to have these multiple symptoms for months. Often they've had a lot of testing, and the tests are generally quite normal. They look well. These are analogous to pain symptoms that I've been dealing with for years, like fibromyalgia or associated chronic fatigue syndrome. So that's been a particular interest of mine in regard to looking at patients who sort of are more invisible and as far as their symptom complexes and how do we explain it. Long COVID is also much more common in women than in men, particularly, again, patients who weren't hospitalized, who didn't have organ damage, and makes it, again, very, very difficult to understand.
So is it safe to say that chronic pain is one of the main characteristics of long COVID?
Yes, that's correct. After the exhaustion and shortness of breath, I would say chronic pain, particularly chronic widespread pain, is a very, very common symptom and something that we've been very interested in.
Okay, thank you. Leslie, let's discuss your symptoms. But before I get into that, I just want to mention a bit of Leslie's journey. Okay. Leslie was diagnosed with COVID-19 in 2021. And sadly, during the time, our partner also had COVID-19 and he passed away from complications of COVID-19. So Leslie chalked up her symptoms to have probably going through grief right. At the, loss of her partner. But then she got COVID again in January 2022, and the symptoms seemed to persist. So Leslie, tell us a bit about, you also had a little bit of chronic pain, I guess fibromyalgia, ATD, and a couple other symptoms before. So how has it been for you? What were you experiencing before, and have you experienced the same, or has it been worse? So tell us a bit more about what you went through with long.
Well, thank you. And thank you for having me today, because this actually also helps validate what I'm going through. And I hope it helps so many others as well to know that this is real. Um, so, yes, Monica, as you mentioned, I've had ADD my whole life. And I also had bouts of fibromyalgia off and on for probably 30 years. And it seemed under control. Um, I also had insomnia for the last year and a half. But I think for me, what happened was when I was diagnosed with COVID the first time, uh, the day that I was tested, I knew immediately I had it because I couldn't. It was my birthday actually, and I went to get a piece of pizza to celebrate, and it tasted like cardboard, and I was so mad. But I thought, well, okay, so I've got it. And so I lost my taste and smell. But unfortunately, Richard was so much sicker than I was. I didn't pay attention to any of my other symptoms. So fast forward, I just thought that everything I was going through was grief. And then after I had COVID the second time in January of this year, which was literally the same week that I'd had it the year before, a few months later, I was visiting my sister, and she was the one that said, I think you have long haul COVID. And I thought, wow, that's crazy. Really? But then I started doing more research on it, and I thought, okay, I've got the brain fog. I've got joint pain that's new in my hands and my feet. It's it's like fibro, but it's different. Um, the insomnia was worse. The fatigue was horrendous. My gut and my colon were acting up like never before. And so I just thought, things kind of come and go, and I attribute it to grief, but then they get worse again. So that's when I realized I needed to pursue more about what was really going on. And this seemed more than just grief.
And that's important, Leslie. I think what you said is being able to recognize that this is something different than what you were experiencing before,
Right.
because it looks like it's sort of hard to diagnose. And I think it's important for patients to understand that if some of the symptoms are back and it's something different than what they had before, they should definitely check with their doctor about the symptoms. Dr. Goldenberg, do you want to add anything here?
Yeah, I think Leslie has a wonderful description of the multitude of symptoms and the difficulty that people have putting these all together. When you go to a doctor, you usually we talk about a chief complaint, and in
Mm-hmm.
people with these conditions like long COVID, but also things like conditions that are very analogous, chronic fatigue syndrome, fibromyalgia. There isn't a chief complaint. There's a multitude of complaints, and we think there's a reason for that. Why do musculoskeletal symptoms, chronic pain, chronic fatigue, cognitive disturbances, even mood and sleep disturbances, why do
Yeah. Yeah.
they all occur together? And I think the reason for that is they've occurred together with all these poorly understood conditions. And I think the answer is in the central nervous system. And that's what we're really homing in on. And I think
Mm-hmm.
many people feel that the attention globally to long COVID will help greatly in research and understanding all these conditions that cause chronic illness and uncertainty, including chronic fatigue
Mm.
and fibromyalgia. That's certainly my hope. But what Leslie experiences, what most people experience, and the key thing is to find a physician who's listening to you and really paying attention to all those complaints.
Thank you for
And,
that. And that's actually, Leslie, I'm just going to come back to you on
okay.
that point, because one of, what you have shared with us is that's been frustrating is that you don't physically look sick. Your condition is sort of can be invisible to family, friends, and healthcare providers, like many other chronic pain disorders. So when did you feel validated for what you were experiencing? And again, it's important what Dr. Goldenberg said, your physician actually believed in you. So can you
Hmm.
share a little bit
Hmm.
about that?
Right. I think it's interesting because, as I had explained earlier, like my allergies are different this year in terms of where it's affecting me. And people can see that because it's my eyes. They're swollen, they're puffy, they itch. Um, But when it comes to joint pain, unless you do this and say, oh, I can't move my hands, um, or oh, I had no sleep last night again, or I spent 7 days dealing with diarrhea because of colon issues. Those are things people can't see, and you have to explain it, right? So after I came back from my sister's, I I thought, you know what, I'm going to pursue this because I want to know if this is real or not in terms of what I'm dealing with. So the best thing I did was I called my GP, who is at the University of Kansas, and they have been a huge proponent of teaching people about COVID and COVID symptoms, et cetera. And my understanding was they had a long haul COVID department at one time, but it was dissolved just because because everyone's symptoms are becoming so much more than just one or two things, right? But the great thing is that my doctor had been involved with that, and so I cannot even tell you that just in the brief conversation we had before I set up an appointment, she immediately validated it and said, I absolutely, tell me your symptoms. And as soon as I did, she was like, yeah, you're a long haul COVID. And it was like a weight had been lifted. Somebody believed me. I wasn't crazy. I wasn't making this up. It wasn't just grief. I mean, grief may have contributed to some of this and vice versa, but it just made all the difference in the world. And she was the one that also encouraged me to enroll in the NIH study because KU is one of the test sites. So
Yeah.
that's how that started to roll. But a validation, it makes a world of difference.
No, Leslie, that is so important that that is key that your physician actually listened to you and validated what you were going through. Dr. Goldenberg, is that why? I mean, tell us again. We've talked about this just a little bit, how with the multitude of symptoms. So, why long COVID is so difficult to diagnose and understand? And from a physician's point of view, I mean, here Leslie was lucky that a physician actually believed her and suggested she participate in a study. But just tell us more about, again, how would you diagnose it and how do you then, validate what someone is going through?
Well, again, if you divide it into these two groups of people who have persistent symptoms after developing COVID infection, the individuals who've had a very stormy, acute, severe course initially, where they were hospitalized, they might have even put on a ventilator, et cetera, that group of patients, it's very accessible to docs knowing what happened to them. So I don't think there's a big issue there, and sometimes they're lumped together as long COVID. What we're talking about more are the people who really didn't have severe COVID, who had no evidence of initial organ damage, their heart, the lungs, the kidneys, et cetera, but have this plethora of symptoms. And this is typical of what some people call the blind spot of medicine. Things like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome. So all the symptoms that Leslie mentioned, every doc who specializes see those frequently. I mean, the cause of headaches is usually unknown. The cause of diarrhea is often irritable bowel syndrome, non-inflammatory bowel disease. So it's difficult for doctors who are very siloed, who think about these things individually and with pathology to put this all together. We're not trained very well in that regard. And that's why maybe long COVID will help in our dealings with it. Right now, the key thing, as Leslie found, is to find a doctor who really understands that, who believes in this constellation of symptoms, why they cluster together, why they can be chronic. And that the one nice thing that's happened is, as you probably all know, long COVID, I like the word long COVID rather than long haul, long COVID clinics have developed all over the world. In the United States, there's at least 110 long COVID clinics. Many of them are funded nationally, some are not. They're really there to help the primary care doctor with understanding it and giving an outlet to look at these patients, to see what tests they need, et cetera, because it can be overwhelming in primary care right now. So that's one option. The other option is to really get primary care doctors. I mean, Leslie fortunately had one initially who was very attuned to this. Many primary care doctors may not be. And that's why episodes like this for the public, as well as for patients, as well as for physicians all the time, on educating people on this long constellation of symptoms is very important.
So is it safe to say that doctors should then, when talking to their patients, understand sort of the history, if they've had some chronic pain conditions beforehand, if they've had COVID-19, and if some of the symptoms that they see have been carried forward from since they've had COVID-19?
Well, you certainly were looking for patients did have a COVID infection. Sometimes that's well documented, sometimes not. But you want to believe the patient here, even if they don't have a positive PCR showing that they have COVID. But the diagnosis usually is made by symptoms. So docs like signs. We like joint swelling. Leslie might not have any joint swelling to account for pain. We like to find rashes. There may not be rashes where people are having skin problems. So it's a problem with, we are trained as physicians to find objective abnormality when the diagnosis in many conditions is based on subjective symptoms. And that's sometimes difficult, but that's how you make a diagnosis of all these chronic illnesses.
That's such a great point. Thank you for that. Let's come back to you and tell us a bit more about the NIH study that you're participating in. And again, what made you join this study? I believe it's one study.
Couple things. One was after I talked to the irony was actually I'd been exploring it at KU just to get more information to see if I qualified and to see if I think part of it was to see if I actually had it. And
What's
then
KU? Can you tell our audience? KU is
the University of Kansas.
Yes.
Yeah. National champions in basketball last year. Yeah, exactly. So, and 4-0 in football. Okay. So anyway, the fact was I had breast cancer 3 years ago as well. And then I had squamous cell cancer on my nose removed the week before I got COVID. So that was also part of the challenge with the COVID was the fact that I didn't know I was sick at first because I thought it was an infection. So fast forward, I've been under the University of Kansas treatment for the last several years, which has been fantastic. And so when I reached out to the GP, it just kind of, everything kind of came together. And the fact is that she said, I think you ought to pursue this. And I said, I've already asked him if I could, if I qualify. And so it all came together. And so the NIH study, and Dr. Goldenberg can explain it better than I can, but I'm now a participant. I may be in it for up to 4 years, depending on how it all works out. And there are surveys that I do, and it's everything from it's all of these issues I've encountered. Even my eyes, my eyesight seems to have changed a little bit too. And so they monitor you, and I just got my second survey, and I'll fill it out and share more about what I'm experiencing. And so, Dr. Goldenberg, do you want to explain a little bit more?
Sure. All I would add to that is it's wonderful that Leslie has been able to sign up for a program like this. And I would encourage people in conditions where we're searching so hard for knowledge, it is important for you to try and think about where can I help others obtain knowledge. And there is a lot of misinformation and disinformation out there in regard to long COVID. And I would rather encourage the audience to look for sites where there's funding, where there's an academic medical center involved, where you can participate in research to help everyone as well as you individually verify the diagnosis and help us figure out more what's going on with this condition.
That's
Absolutely.
great. Yeah. And Leslie, that's great that you're able to participate in this study. And I hope there are other women and other people from our audience are able to do that too. Let's now come back, Leslie, to you. Tell us more about, again, how has your life been different after being diagnosed with long COVID? I mean, you've gone through, your journey is something. You've gone through a lot. And then how are you taking back your life right now?
Well, I will admit my life has been turned completely upside down, especially with Richard's death from COVID. And as Dr. Goldenberg was talking, there is something that was when he was on the ventilator, because he fought for 6 weeks, really hard. And I was able to be there the last 2 weeks. But one of the doctors that I talked to said to me, I think he will be a long hauler if he makes it. And the thing is, you're going to have to be prepared for what that's going to be like for him. And he may not want to be a long hauler. I mean, do you understand how terrible his life will be? And so I have to say that has stuck in my head forever. And I think what it's done for me is that now I'm the long hauler. He didn't make it. And so because of that, I've had to make some decisions about how I'm going to take action, right? And have hope, because I think that's what's critical is what's happened for me is that I've had to surround myself with really supportive, non-judgmental family and friends. Because again, if you can't see this, people think it's grief and they think you need to be over your grief by now. But this is not just grief. And so surrounding myself with family and friends who are not, who understand my ups and downs with the symptoms has been critical. Seeking out a doctor who believed me, because when I was diagnosed with fibromyalgia about 30 years ago, nobody believed you. Nobody understood. It was horrible. And you think you're crazy, that you're making all this up. So fast forward, having a doctor who not only validates you, but encourages you is critical. And I just want women to know, be persistent. Do not give up. If your doctor doesn't believe you, keep looking. They are out there. And it will lift such a burden off your shoulders that you are not making this up. That I think it also helps you heal in many ways. Having hope on dark days is challenging, but just go for it. And then the other things that I've really done is stretch. Try to do as much stretching as possible. It may be in the middle of the night when I can't move my hands. Try to exercise, try to meditate, but find an activity that brings you joy. And pickleball is mine. And I am so addicted to it. It got me through breast cancer. It's gotten me through COVID. And the group of women I play with are so much fun. And I think laughter is critical as well. I mean, yeah, you've got to have laughter. It just releases so much. But then the last thing is, I don't want others to go through this. And I really think I'm motivated because Richard's not here and I'm the long hauler. So I've got to make the most of what I've got.
Yeah, no, thanks for sharing that, Leslie. You're such an inspiration. Well, I'm looking at the time. Let's open up for questions to the audience now. So here's our first question from Caroline. And if I think I have long COVID, what is my first step to getting diagnosed with long COVID? Dr. Goldenberg, do you want to take this?
I think as we both discussed, you need to find a doctor who's familiar with it, who listens to you. Hopefully that's going to be your primary care physician to start with, that Leslie found the right one. But if not, do your homework, look around, and think about possibly, if you're not getting where you think you need to be with information, go to a long COVID clinic, and they're now available throughout the United States.
Leslie, do you want to add anything to this?
Yes, I think I've noted it before, that if you've had previous symptoms, like I had fibromyalgia before, I've had ADD my whole life, and maybe a few of these other things. But what I found, and actually the clinicians in the long haul study validated as well, is that they're hearing the same thing, is that if you had some of these previous symptoms, like my brain fog, my Adderall didn't work. And that was a clue to me that I always get the term wrong. Is it what is it? Thank you. So the things that I had before are worse. And to me, that was also one of the key that I had long haul COVID, that this was not just grief, that my thinking was completely different. And the medication I was on wasn't helping. And the new joint pains that I had where do those come from? So,
Mhm.
so to me, if those are some of the, if you have had previous things and if they are worse, then I, I, I think you've got it.
Yeah. All right. Do we have, okay, now we have a question here. Do certain conditions put people at greater risk for long COVID?
Yeah, that's an important question. I think Leslie just touched on it. The issue is, did pre-existing fibromyalgia, pre-existing,
Mm.
ADD, whatever, does that predispose somebody, even though the symptoms are different? And the
Mhm.
truth is, it's possible. In fact, probably likely. If we have a predisposition to certain types of chronic illnesses, and we were struck with a new inciting precipitating factor, it seems logical that those chronic symptoms might get worse, and they may be very different, as Leslie was saying. So yes, having certain conditions will put people at greater risk for long COVID. A flip side of that would be, well, what can you do about that? One of the things that you can do about that is not get COVID in the first place, which of course we don't
Yeah.
have much control over. But I would
Right.
encourage people to get vaccinated. And one of the things,
Yeah.
even with regard, there are some studies now, even looking at vaccine and boosters, that does lessen long COVID symptomatology. And it's really the only way that we can prevent
Mhm.
COVID, long COVID, is not to get in the first place. So take advantage of what we have out there for vaccination.
Good point. Do we have, okay, we have one more question here. Says, fabulous statement. If your doctor isn't hearing you, don't give up. Find another if possible, but don't accept not being heard. So
Right.
just a repeat of what you're saying. All right, any other questions? Let's see. Okay, I don't think at this point, but we encourage the audience to write to us if you have any other questions, and hopefully we can still follow up with you. Again, I want to thank our audience for joining us today for another conversation on Women Talk. Again, to learn more about Leslie's journey with long COVID, we will be featuring her story on our website soon, so please be on the lookout for that. Our next episode on Women Talk is on Wednesday, September 28th. 28th. And again, we'll be talking about long COVID, the long haul part 2. I also want to thank Practical Pain Management for their support as we try to understand this chronic disorder and the best ways to treat those living with it. Again, thank you, Dr. Goldenberg and Leslie, for taking time
Thank
out
you.
today for your busy schedule to share your experience and expertise with us. Again, thanks to your audience. See you next time.
Okay.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women Live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, YouTube, or LinkedIn, or follow us on Instagram at healthywomen.org. We'll see you next time.